Hi, I'm Dr. Brian McDonough. People are very excited about the vaccine, but you need to know certain things. Again, I'm a big fan of the vaccine. It's our way out of this pandemic, but we need to manage expectations. So here's where it starts. First of all, the first groups to get the vaccine will be frontline healthcare workers. Most people will probably have to wait 2 or more months to become vaccinated before it's widely available. In addition, the Pfizer and Moderna vaccines also require 2 doses. As a result, people will need a second shot after 3 and 4 weeks, respectively, to get that full protection. And that's the big thing, full protection. To get herd immunity, as many as 70% of us have to get vaccinated, which then makes the whole community better off. But listen to what I said about that first and second shot. If you get the first shot and think you are done, and think you can take off your mask, and think you can go out into the community, you very likely will get COVID and you'll very likely get symptoms. They may not be as bad as if you were never vaccinated, but they're still not going to be great. And that's a problem because if people do that, they're obviously going to get on social media and say this vaccine's horrible, it causes these symptoms, and then others will be afraid to get it. In addition to that, that first group of people who get the vaccines, people like me on the front lines who are going to get it as healthcare workers, are kind of a trial group, like we're the next phase of a study, if you call it phase 4, because they're going to give it to us and they're going to see if there are other side effects as a wider group of population gets it. So again, we're watching this and growing as we move along. So we have to manage expectations. You have to say, like, we've got a vaccine. Far and away, a vaccine is far better than getting COVID. In addition, the vaccine will allow us to ultimately get to the point, hopefully, where we can take off masks and start to go to the movies and do those things we all love. But on the way, we're still learning. It's not going to be no symptoms, no side effects, no problems. There will be issues. They shouldn't be major because we're talking about an effective vaccine with very limited side effects. But let's not fool ourselves. People might get headaches. They might feel a little weak. They might have pain at the injection site, kind of like you get with a flu vaccine. And if other things happen, we're all going to be watched very closely. So managing expectations, understanding it's not going to be perfect is really important here because with social media and with the ability of others who may not believe in vaccines trying to talk it down, we're going to have the truth, consistent scientific explanations, full transparency, and a discussion as a nation from a trusted source. That's going to be really important if this is going to work.